We talked about aspirin and what aspirin is used for. And here we have some stronger antiplatelet agents. Many times these drugs are given after a cardiac event of some type. These three drugs that tend to be stronger are known as dipyridamole, ticlopidine, or clopidogrel. Clopidogrel is probably the one that we're most familiar with because its trade name is Plavix. Dipyridamole is Prasantine, and ticlopidine is Ticlid. And so you might see these given to prevent further MIs in men. They can be given along with thrombolytics, or what we call clot busters, to prevent an MI or a stroke. And then after cardiac stents have been placed, many times the doctor will give Plavix for a year or longer after the placement of a stent to make sure that it's going to stay open. Occasionally you will see the drug dipyridamole or Prasantine given along with a dose of aspirin. And those two drugs together make up a drug called Aggrenox. That's AGGRENOX. So I would write that down on your paper PowerPoint or on your notes as you're going along. Aggrenox is Prasantine and aspirin given together. On page 269, we see a safety alert that tells signs and symptoms of internal bleeding that you need to watch for. Easy bleeding, increased bruising, petechiae, the little pinpoint hemorrhages. Very important to know all those. Even shortness of breath can indicate that you have some bleeding somewhere, many times in the GI tract, that is lowering your hematocrit and making you anemic because of that bleeding you might not be aware of. So make sure you recognize that safety alert. Also, a number of drug interactions, especially in things that you might not even really think about. When you are taking Coumadin, of course, you're told not to eat as many items that have vitamin K in them, but a lot of herbs can cause bleeding and complicate the use of these anticoagulants or the platelet aggregation inhibitors. Make sure you read drug and food interactions on page 269, as well as some of those herbal drugs that can interact and cause problems with bleeding. This is a little graphic that shows some of the new anticoagulants on the market. And let me try to tilt that back. These you'd recognize: Xarelto, Eliquis, and Pradaxa are the three drugs, and these are their generic names. And they are approved for some conditions and not others. Xarelto, or rivaroxaban, is the only one that's ordered for prevention of stroke in AFib, treatment of blood clots either in the legs or the lungs, or prophylactically for post-orthopedic surgery. These drugs are known as direct thrombin inhibitors. They work right on the enzyme, or they work with the enzyme that controls thrombin, which is known as factor II. So these drugs can be used to prevent clots in arteries and veins. They can treat both deep vein thromboses and pulmonary emboli. Many times they're given in the event of AFib. The danger with that cardiac arrhythmia is that little microclots will be thrown out into circulation, and one of them can temporarily or permanently block oxygenated blood from going to the brain and cause a stroke. These drugs just generally decrease the risk of embolism and stroke and can prevent the formation of clots after surgery. Now, these drugs have advantages and they have disadvantages. I've got a link to an article in the Journal of Clinical Pathology that gives some information about the short half-life and the predictable bioavailability of these medications. And that's good. These drugs don't require blood testing like the heparins and Coumadins do. They're a lot easier to dose and don't require any dietary issues. So we can see these drugs, their generic and trade names, Pradaxa, Xarelto, Eliquis, and then a newer one, Edoxaban or Savasa. You might have seen that advertised, but generally it's going to be Xarelto, Eliquis, and Pradaxa. The only downside to these is there's no fast antidote for toxicity. So whereas if somebody is bleeding because they're on heparin or they're having internal bleeding with Coumadin, we have antidotes to give for those. And we will talk about what those are when we talk about this particular drugs. But there are no fast antidotes for the direct thrombin inhibitors. And so they are developing one for Pradaxa, but the last I heard it is not ready yet. And this can cause uncontrolled bleeding in the event that there's some sort of emergency. If a person on one of these thrombin inhibitors is in an accident or they need emergency surgery, bleeding can be very hard to stop. If they know that surgery or some kind of invasive procedure is coming up, they can stop taking this drug temporarily for a couple of weeks. But if it's an emergent situation, they end up being at risk of bleeding too much if they're on one of these meds. And that's about the only drawback. People like these drugs because they don't have to get a bunch of lab tests and they don't have to limit their diet. So when it comes to these drugs, you want to keep these drugs in their original bottle. They're very sensitive to light. Of course, the most common adverse reaction with the antiplatelet drugs is abnormal bleeding. One of the first signs of any kind of abnormal bleeding with any anticoagulant is bleeding gums. You go to brush your teeth, you smile at yourself in the mirror, and you notice that your gums are oozing. And that can be a sign maybe that you've got a little bit too much antiplatelet drug on board. You want to avoid aspirin or NSAIDs, both of which can cause bleeding by themselves, and if you combine them with other antiplatelet agents or with these thrombin inhibitors, you're going to increase your risk of bleeding. Like I just said, many herbal drugs increase risk of bleeding, and some of those are St. John's wort, garlic, ginkgo, fish oil, and turmeric. Turmeric's one of these drugs that's really in vogue right now because of joint and muscle aches. A lot of people are taking these, and so we need to warn them that it can interfere with their clotting. Before we talk about specific anticoagulants, I just want to direct your attention to this graphic that I have put on the PowerPoint. You can see the deep veins of the legs, not the surface ones that we can see, but the larger veins. They have valves, and that keeps the blood going uphill when we're up and standing and walking. Different factors can lead to the blood slowing down, pooling inside a leg vein, and many times that blood will clot. We know that blood that slows down is blood that will clot, and many times in these valves, blood can catch, blood cells can catch, they can be torn, the platelets will begin sticking, and we can end up with a clot deep inside that leg. If it breaks off, it's called an embolus, and those can be deadly, especially if it goes to the lungs. It can take about a half hour after a clot breaks off inside a deep vein of the leg and travels to the lungs or the heart or the brain, and any of those can cause deadly clots, strokes, heart attacks, and pulmonary emboli.